All right, so this week we're going to go over hormones and weight loss. I'm pretty excited about this. I've been studying this stuff for a while. I'm going to be taking another conference again this weekend. So again, talking about insulin, insulin just affects so many different areas. It definitely affects testosterone levels for women. If I run their blood work, if I see someone with high testosterone and they're not taking testosterone already, I'll be like, they probably have like PCOS, polycystic ovarian, which is a insulin problem. And so if they have high insulin, they're going to have higher testosterone. If a man has high insulin, they're going to have usually higher estrogen. It does affect our blood pressure, cholesterol, our liver, just more oxidative stress. So many different areas. What it turns out is insulin affects every system in our body. And I think I told you about this book last week, Why We Get Sick by Benjamin Bickman. I've been reading it, and I just find it so fascinating how it affects every single system of the body. It's really quite interesting. It affects our hormones as well. So aging, does aging cause weight gain? So, as we get into menopause, it certainly does. When women enter menopause, the loss of estrogen in and of itself will cause you to become more insulin resistant. And so there's definitely a link between aging and obesity. So hormone loss will cause increased abdominal weight gain. So it tends to aggregate in the stomach area. And then all this visceral fat is due to insulin resistance, as we're finding out more and more. And optimizing our hormones is going to help to control this fat deposition. And that's certainly my strategy. I'm going through just starting menopause now. And I'm like, I'm going to take my estrogen. I don't want to, get a lot of visceral fat. So I'm doing my self-experiment and doing the studies show that the loss of estrogen was directly related to visceral fat. So if by supplementing with it, it could certainly help as well. So here are some of the other hormones other than insulin that are related to weight loss. So of course, thyroid, we're going to go into thyroid and how it affects insulin and affects our weight. Estrogen, progesterone, testosterone for sure, cortisol and DHEA, all of these are affected by aging, menopause, and insulin resistance. So this is some research. So low estrogen accelerates the development of insulin resistance and type 2 diabetes. That's why many women, as they go into menopause, I had a gal yesterday, the last year she's gained 15 pounds. So low DHEA is associated with central obesity. That's another hormone from the adrenal glands. And testosterone is associated with higher visceral fat. So whenever we see, especially there's obviously a lot of research in regards to testosterone in men. There is some research with women as well, but most of the research is with men. And the men with a lot of overweight men have insulin resistance. And so which came first, right? The chicken or the egg? Does the insulin resistance come first or is it the low T, right? So that's a question that I've been coming up with lately. So, and then normal's not optimal. So as we age, normal hormones should be like at 0. So that doesn't mean that's optimal, right? So hormones will decline as we age. So it's not normal. I guess it's even normal is to have no estrogen when you're in menopause, but is that optimal? Is that going to help? And so a lot of other diseases are associated when women go through menopause, their risk for cardiovascular disease goes up 50%, risk for dementia, risk for osteoporosis. So all these diseases, of aging are really related to our hormones. And so with the loss of hormone, we're at much greater risk. And weight gain is definitely one of those risks that are associated with menopause. And so if we want to optimize, I think the hormones really help. Are they dangerous? Not if they're done in the right way. I think in the old days when I first, started practicing, there was like, oh, the wise woman, right? And, you shouldn't take hormones. Well, there's so much research and data to show the benefits of hormones when they're dosed correctly. So there's a lot of benefits that I have found, I have always had a lot of questions about hormones. Some women don't want to take hormones, and I respect that quite a bit. However, I think it's better to age feeling better. So as long as, again, you're not increasing your risk. And again, I'm always first, do no harm. And so someone with, people always say, what's my risk for cancer even? Well, with estrogen, there were some studies, does it increase the risk for breast cancer? Well, the research now is showing that the women that actually are on hormone therapy do better than the ones without it. So there's always two sides of the coin, and it's good to read both the data, and that's why I continue to take the classes that I do, because I want to know what's happening with the research and do best by my patients, right? So how we feel, how you function, and of course, hormones affect how you metabolize. And so we'll start off with the thyroid. So the thyroid is the gland in front of the neck. It affects almost every cell in the body, and there's so many symptoms related to low thyroid, and insulin receptor, insulin sensitivity is definitely one of them. The thyroid is most noted to affect temperature. So if you're cold all the time, it does help with your metabolism. It helps with memory and mood, and of course with energy. So oftentimes when people come in, they say they're so fatigued. Of course, I'm going to check their thyroid, but also their adrenal glands, and every other hormone as well. All the hormones are related to energy too, but thyroid is a big one, and thyroid does tend to go down with age. So again, the thyroid, helps with metabolism. It definitely helps with fat breakdown. It can help with weight loss. In the old days, before statin drugs came out, they would definitely give you thyroid to help lower your cholesterol. So it does help with cholesterol, and therefore it can affect your heart disease, cognition and memory. So people that are like foggy brain, or their brain's not working right, or slow, foggy, thyroid definitely is a factor. And if you're low thyroid, it's going to affect the sensitivity of the insulin, which means you're basically going to be more insulin resistant. The insulin isn't going to be as effective. And so when you're hypothyroid, the fat cells take up less glucose in response to insulin. So the fat cells aren't going to be picked up as much. And with low thyroid, your insulin levels are going to go up. So these are some of the other symptoms. I love working with thyroid because it affects so many different areas, and just a little bit of thyroid can help many different areas. It helps with memory and focus. Again, I had a gal yesterday, her, my memory is awful, but so we're checking all the different hormones. It can even help with sex drive, which didn't, who would think that, right? So cold hands and feet, thinning hair, your nails, muscle cramps, fatigue, feeling sluggish, again, dry skin and fluid retention. So there's a lot of different symptoms for low thyroid. Next, we're going to talk a little bit about estrogen. So estrogen is such an important hormone, secreted from the ovaries. It's also secreted from your adrenal glands, and it also is secreted from the fat. So women, when they're overweight, in their menopausal, and I measure the estrogen, they still can have some estrogen. It might not be 0, it might be at a level of 15 or something, and that's because it's being stored in the fat. Doesn't mean it's the good estrogen. Keep in mind there's many different types of estrogen. So there's estrone, estradiol, and estriol or estriol. And then there's different types of estrogen receptors. There's these alpha and beta receptors. And so one is better than the other. And typically say in the cancer cells, they found most recently, from what I've learned, is that the breast cancer has more of one type of receptor than another, and that the estrogen that we supplement with is actually the better kind. A lot to it. So in at OHSU, Oregon Health Science, right here in Portland, women were noticing increased weight following menopause. So they did a study, and they found that the low estrogen was also associated with an increase in cortisol, which is an adrenal hormone. And high cortisol is going to also affect our insulin sensitivity. And so the estrogen and the cortisol work together to help balance that out. And so what they found is that when you're dropping estrogen, it's going to help low estrogen will cause you to gain some weight, but if you supplement with it, it helps prevent it. And so this is just showing, again, the estrogen and the cortisol relationship. Cortisol is an adrenal hormone, and that the body is really a symphony of hormones. So if you get low on one, it's going to raise another. And you really want to kind of look at all the different hormones because it is a symphony. And if one instrument is not playing, the whole orchestra is not sounding as good. When you take a little bit of estrogen, your fasting insulin will come down. You're going to have improved insulin resistance, so your insulin sensitivity is going to be better. Your hemoglobin A1C, which is your average blood sugar, will come down. So estrogen can impact your insulin and blood sugar. So real important to do this, to supplement with this if you're interested in that. So when someone, there's also estrogen dominance. And so when people are perimenopausal, they'll tend to be, progesterone is the first hormone to go down. And so people get estrogen dominant. And when you're estrogen dominant, meaning you have more estrogen in relationship to progesterone, you're going to get a little bit more fluid retention. You're going to gain some weight, some bloating, and you're going to feel a little bit puffy. So a little bit more excess weight, and progesterone can definitely help with that. So progesterone, no woman should be without it. That's a quote from Dr. Neil Rouzier, my teacher. And progesterone balances estrogen's effects. It does help mobilize fat for energy. What I really didn't realize, before I took my classwork, is that it does help reduce water retention. And so it does help balance fluids in the body. Progesterone is considered a feel-good hormone. It definitely is like a relaxant, so it'll help reduce anxiety. It can help with depression as well, and therefore it improves mental function. All the hormones work together to help with sex drive. And progesterone does help optimize other hormones. So in particular, it helps optimize thyroid, testosterone. It actually convert right down. All the hormones are kind of metabolized from cholesterol. So cholesterol is where all hormones are. So if your cholesterol is too low, you can't make any hormones. And so progesterone will kind of convert down into testosterone and estrogen. So again, progesterone is a mild diuretic. It can help reduce bloating. It can help with headaches through the fluid, and also it is a little bit of a muscle relaxant. It definitely helps with bleeding. So someone is, say you're perimenopausal and you're having a lot of excess bleeding, it'll help stop that bleeding, because typically the extra bleeding is to a lack of progesterone, so that estrogen dominance. There's a number of studies to show that it helps protect against breast cancer and heart disease along with the estrogen. So what they found is that the studies, when they gave estrogen alone versus estrogen and progesterone, the natural progesterone, that it helps save off cancer. All right, so testosterone, again, so many studies are done mostly on men, but testosterone can be so helpful for women. Again, it's made in the ovaries and as well in the adrenal glands. And testosterone can help your muscle function. So muscles burn more calories than fat. So the more muscle you have, the more insulin sensitive you're going to be as well. And the more muscle you have, you're going to have a higher metabolism. So getting your muscle strength and function, and testosterone can definitely help with that. So some of the symptoms of low testosterone, again, loss of muscle mass. It definitely reduces insulin sensitivity. You'll gain some body fat because of the reduced insulin sensitivity. So what they found is that the more insulin you have circulating in the blood, the fatter you get, even if you had the same amount of calorie. So if you and a friend both ate, the same 1,200 calorie diet, if one of you may secrete more insulin than the other. And so whoever secretes the most insulin wins, wins the weight gain. So, and then also that has to do with the frequency of eating. If you're eating, that same 1,200 calories and you're spreading it out throughout the day, you're going to secrete more insulin. So you're going to have, gain more weight by spreading out the food over a long period of time. So when you're low T, you're going to be more insulin resistant. Also, your libido is going to be lower, and it affects your mood. So one of the wonderful things I love about testosterone for women, especially, is that it does help with mood. So I've seen a lot of people say that they're feeling so much better emotionally. It does have a tricyclic antidepressant effect in the brain. So here's specifically for women, it helps improve body composition. It helps reduce visceral fat, so that's that stomach fat, and helps with the subcutaneous fat, so the fat just like kind of in your arms and legs. It helps decrease the cellulite and deposition of fat. It helps improve our mood, our strength, our endurance. It does help improve bone density as well. So people, women especially with osteoporosis, all the hormones really help. Testosterone's a big one. It helps with sexual function. It helps with orgasmic ability, maintaining muscle mass and metabolism within those muscles. It does help with skin texture and does help with wrinkles. And it does help prevent diabetes and heart disease. Testosterone's beneficial effect for women improves body composition, confidence, self-esteem, competence, competitive drive, assertiveness. So kind of that get up and go, like, I got this. It does help a lot with the vaginal lubrication. So sometimes women that are having some vaginal atrophy, they find that they're a little bit more lubricated down there. So with adrenals, so the adrenal glands secrete cortisol and DHEA. So the adrenals sit right on top of the kidneys, and they do help a lot with stress and other hormones, as with epinephrine, the fight or flight hormones. Also help with pain. Prolonged stress will take its toll, and it will affect our insulin sensitivity. So oftentimes if people have fatigue, I'll look at their cortisol levels as well as their thyroid. So again, cortisol can help improve body composition. Too much cortisol is going to cause you to be insulin resistant. It's our main stress hormone. So someone that's under a lot of stress will have high cortisol, and the high cortisol is going to affect the insulin and have you be more insulin resistant and gain weight. People tend to crave more foods, and they don't sleep as well. High cortisol at night will affect your sleep. It affects your melatonin levels. So high cortisol at night will cause you to have low melatonin. People have a little bit more anxiety when their cortisol is high. Again, what came first, the chicken or the egg? A lot of times, a lot of stress will cause a lot of anxiety. And you'll feel burned out. So they have this thing called adrenal fatigue. People that are adrenal fatigued, they're going to just feel like, I cannot do any more. I am just exhausted. Progesterone can also help support cortisol. And if people are under a lot of stress, it's going to pull the progesterone down that pathway. And so you end up with a little bit less progesterone. Again, the insulin is going to affect your cortisol, and the cortisol is going to affect your blood sugar. So it's kind of like a vicious cycle there. And then DHEA. So DHEA is another important hormone for weight loss. It helps with the prevention and treatment of metabolic syndrome. We talked about that last time. Weight gain is a big symptom of metabolic syndrome and insulin resistance. It helps to reduce visceral fat. So again, it's going to help the insulin sensitivity. DHEA is a big one for your immune system. I actually was listening to a lecture the other day about DHEA and the immune system, and how anyone with any kind of autoimmune disease and just your immune health in particular, and especially with the flu that's going around, it can help with immunity, and is often neglected. It's not really even talked about. Improve bone density. So it's going to help with bone density. Again, people with, because it affects your cortisol levels as well, it's going to improve your energy, mood, and well-being. There are some studies to show that it will help inhibit breast cancer. It's not one that I would say, oh yeah, definitely take this for breast cancer, but there are studies to show that it can help support that. And it definitely helps support the vaginal epithelium. You can even do a vaginal suppository, which can be very helpful for that region as well. Oh yeah, so vitamin D. Vitamin D is actually a pro-hormone. And so it's a hormone from the skin, right? It gets metabolized through the skin. Vitamin D has so many effects. It affects our strength. It affects our mood. Vitamin D, our immune system, helps with cancer. I've seen a lot of people with muscle aches and pains will be very low in vitamin D. So it can help reduce pain and arthritis. The study showed to reduce Alzheimer's, so it's very good for brain health, helps with sleep. So it's going to help with improving bone density. It does help our weight. So it's going to, all these things are going to affect our insulin resistance as well. So any bowel problems, it says here, so people with kind of irritable bowel type of problems, of course, better tooth and gum health. That's the other thing with estrogen. They talk about people because it does help our skin. And so people that are low estrogen for a long time can have some gum issues and teeth problems. So estrogen helps with tooth and gum issues as well.